We've heard provinces like Saskatchewan, Alberta, BC talk about their keenness to reopen soon. But looking at the testing numbers and your emphasis on the need for mass testing before we reopen, can you talk about what you see would be the optimum testing level? What capacity do you want to see? We're only now at not even 20,000 a day the other day, you said, but the numbers you post online suggest that we're far from widely testing in Canada. So what's the optimum number? How do you see that unrolling?
I think interestingly, not the majority of countries don't actually have an optimal number, but we do need to have a bit of a target to work with. I know that we collaborate across Canada with provincial and territorial laboratories, and that the capacity right now can increase to triple that amount, essentially, to close to 60,000. And we need the whole system to be working and people being tested. But there are essentially an increase in capacity being built within the provinces and territories. We're continuing to, of course, provide supplies and figure out all lines of supply, whether it's reagents or swabs, and that happens on a very daily basis, and we've been able to satisfy the requests of the provinces and territories. So I think that's just the first layer. We are trying to ascertain how much of the point-of-care testing devices that we can acquire. So Spartan is just one of them. That's the Canadian company. But we're acquiring international sources as well. And so those expected to be distributed across the country, but targeting at the more rural and areas where they can't access bigger labs right now. So we are, at the moment, working out some of the optimal lab testing strategy going forwards. And that is just on the virus testing. And as the serologic testings come on board, we'll also be looking at how do we best use those to ascertain the level of immunity in the population. But then once they're validated, what their role is in terms of the actual support to our diagnostics as well. So it is a bit of a target in evolution, but as a first tranche, roughly close to 60,000 is where the provinces can potentially expand to as a target already.
So just to clarify, that 60,000, you mean that's a national figure per day? Is it, you're not saying in each province that wants to reopen?
That's the national.
Okay, yes. And just, you mentioned the serological testing, and I'm curious to how close you think Health Canada is to approving those, because a number of provinces have talked that they're working with the national lab right now to do that and have mentioned within weeks. So how close are you to having those tests approved, and how do you see them working? Do you see them as something that is well down the road in terms of assessing population immunity? And given the reports we hear about asymptomatic transmission, how crucial are they?
Yeah, so as the first application, I think, of serologic testing is to detect across Canada what population had in fact been exposed to this virus, because we do know that lab-confirmed cases right now of the people who have presented or who have been tested is the tip of the iceberg. So serologic testing offers the opportunity to get a handle on what the level of immunity may be in Canada. So that's definitely one of the key objectives. I think our lab is working really hard at validating the serologic tests that are being presented. I think internationally we're aware that some of them actually don't work. So we want to make sure the ones that we have actually are effective and can detect the antibody response in the Canadian population. It's quite an interesting process because we have to collect, of course, plasma or serum from actual confirmed cases and then validate it against people who don't have it as a negative control. Those are just some of the studies going on right now, but we expect that to be imminent in terms of the completion of at least some of those diagnostics and offering. On top of things that can roll out, our National Microbiology Lab, of course, as a reference laboratory, is developing the confirmatory testing for serologic tests as well.